We are going to be looking at upholding standards in occupational therapy, addressing systemic irregularities, and ensuring compliance with professional code of conduct. We have joined us virtually from Benin City, Edo State, Nigeria, a professional therapist who has been in the helms of affair as far as the occupation is concerned. She's an occupational therapist in person of Dr. Victoria Omua. Thank you so much for coming to the program.
Thank you so much for having me again. ITV, I think I'm a shareholder with you guys. So you guys need to be paying me my dividend.
You're certainly a shareholder, and we appreciate you for always finding time to be on the platform.
Thank you.
All right, let's begin now. Could you begin by giving us an overview of the current state of the occupational therapy system in Nigeria, especially you were one time leading this group. So tell us what is happening currently. Give us an overview of the current state of the occupational therapy.
Occupational therapy in Nigeria is developing. When I came into the country 2005, it was just a few centers that had, it was just psych centers that had occupational therapy. Now you have occupational therapy departments in most of the teaching hospitals. In Nigeria, is developing because we are just counting maybe um, 35 years of occupational therapy in Nigeria. Is recognized in today is recognized in the teaching hospitals. Most of the teaching hospitals have a department of occupational therapy, but there are certain sectors that don't have it. You don't have private hospitals having occupational therapy center, although the private hospital owners know the essence of rehabilitation, and rehabilitation they know is occupational therapy, physiotherapy, and speech therapy. So, but it's not. So, but this is also due to lack of awareness. This it's understanding of the importance, like I said. Most people know that it's there, but the importance of it, most people make do with just physiotherapy. Even patients, fail to demand for rehabilitation to the extent of having OTs. They would rather just have physio, and physio is way different from occupational therapy. Then you also have shortage of trained personnel. You also have limited government support. Limited government support hinders it. And when there's government support, it means that all the healthcare system, like if you take Edo State, all the hospitals will have an occupational therapy department and a physiotherapy department. But because of limited government support, you have very limited you have limitations in the profession in those areas. Then you have professional bodies, you know like when I was the president of the association, I did a lot in trying to get awareness out, and that's how a lot of the teaching hospitals are now have occupational therapy department.
Okay.
So the regulatory bodies, the professional body, we do have one regulatory body, which is good. The body is the body that regulates occupational therapy and physiotherapy and speech therapy. It's a federal government regulatory body. It's called Medical Rehabilitation and Therapists Board of Nigeria.
Okay. So
So
let's
raise awareness. Mhm.
okay, apart from your awareness now that you have done while you were in office, what are the specific irregularities that you have observed now within the field, and how do they affect both practitioners and patients?
Irregularities with OT is inconsistent service quality. When you say consistent service quality, it means that even when OTs function in teaching hospitals, the OT departments lack treatment tools, to function. Like you're a lab scientist, you need a laboratory, and you need a microscope, I'm sure, for lab to be able to look at the blood content and look at when the blood is diseased and what is going on. So for OTs, the OTs, the things that bring about irregularities are the OT departments are not adequately um, there's no provision for adequate tools for services to patients.
Mm.
There's lack of standardized training. Okay, when we talk about training in Nigeria, how many universities train occupational therapists? We only have two notable ones. Obafemi Awolowo University has been training occupational therapists for the last 20 years. Then College of Medical Sciences, Ondo State, just started 3 years ago to train occupational therapists. So when you have, and then you have limited resources. Limited resources, when I talk about limited resources, it takes me back to health insurance. Do we have health insurance that puts rehabilitation, because now know that rehabilitation includes occupational therapy and physiotherapy and speech. Do you have health insurance that includes them as primary care? Allows members, people who have health insurance, to be able to access rehabilitation as primary care, which means that when they come into the hospital, they are the acute stage of their diagnosis before surgery. Are they able to access acute care? So these causes are the main causes of the irregularities. And then how does it affect the practitioner? There's limited professional growth, because you must have tools and equipment to be able to practice. And if you don't have that, you would not have growth. You would not be, there's no environment for the practitioner. The patient struggles the practitioner struggles to provide optimal care to the patient, because there are no equipment, there are no assessment tools, there are no evaluation tools, and the space that probably are given to OTs are very limiting space and very confining. So for the patients, you have inconsistent, inadequate treatment. It impacts the ability for best possible outcome. Okay, let me give you an example. I'm an occupational therapist, and a patient comes in with a CVA, stroke, and the patient is referred to me. If I do not have the tools to be able to improve this patient's outcome adequately at the time that I should, which is the first 3 months, what tools do I need? I need a department. I need infrastructural things, treatment tools that I'll be able to, and I don't. And all I have is to talk to the patient. I don't have devices to be able to strengthen the patient's upper extremities. I don't have the toilet training, the ADL room to be able to take this patient to ADL room and have them actually transfer to toilet and bath. I don't have the enabling environment within the simulated environment within the therapy room to be able to simulate the house, the ambience of the house, so that when this patient actually leaves the hospital, the patient is going to be able to strive better. So when those things are not there, you're going to have irregularities in occupational therapy, and occupational therapy is a vital part of rehabilitation. A lot of our elites leave Nigeria when they have things like cerebral vascular accidents, which is stroke. They go abroad, not because, beside the fact that they want the optimum care from doctors, they also look at the rehabilitation part, because the rehabilitation part is what will enable you to be able to go back to your work. So they look at both.
Okay, now let's look at this now this way. How does the Occupational Therapy Code of Conduct aim to address some of these challenges that you have mentioned, and what role does it play in ensuring quality standards?
The code of conduct for the occupational therapy is a structured framework of ethics and ethical professional behavior. What do I mean by that? I mean that the therapist is supposed to uphold quality of standards. It's supposed to treat patients with respect, integrity, and be professional at all times. when I say professional at all times, when you start to treat a patient, you start to get familiar with them, you start to get familiar with family, you start to get familiar with this. But there must be a line where you don't cross the line. You don't get, because after you become familiar with the patient and you're treating the patient, and the patient is getting better, the patient now decides to be independent on you, dependent on you. you know that means the patient sees you as the messiah. So you must be, this is where your professionalism comes in, and the code of conduct upholds such professionalism. It also tells us to enhance patient trust. The patient has to, from day one of seeing you and assessing you, the patient must understand that they are going to be able to get well under your treatment. So, and the time frame of getting well is one of the things we do as occupational therapists, because when we get the patient, we always set short-term goals and long-term goals. Short-term goals are goals that we intend to meet within the first 4 weeks of treatment. The long-term goals are the ones we intend to meet within the first 8 weeks of treatment. So those are the things that guide our code of conduct. We ensure that service delivery meets national and international standards. Anywhere you see an occupational therapist practicing, those are the salient things that drive their practice: accountability, trust, and integrity.
Okay, what are some of the common areas where practitioners may unintentionally deviate from the code that you have mentioned, and how can awareness be improved in these areas?
A lot of a lot of um, a lot of practitioners deviate. When they deviate, because there is lack of infrastructure for them to practice. So when I come in into the OT department and I do not have tools for practice, and I know that I need to simulate a house environment, and the hospital does not have an ADL room. An ADL room is a simulation of the house, the living room, the bathroom, the toilet, the kitchen. Um, how would irregularities come about? How do I simulate a kitchen environment when I have a CVA patient and I need to do standing balance? What do I do? Do I take the patient outside the building, you know, or take the patient to the reception of the hospital and have the patient stand behind the treatment, behind the clerks, who are probably the clerks who are clerking in the patients. So those are the remedy. And most of the things that cause these irregularities are lack of limited government funding, government funding and policy gap. A lot of lack of government funding and policy gap is the cause of this irregularity. If government adequately puts enough money for OT, for health, and when government puts money for health, the occupational therapy department or physical therapy department has a standard amount of money that goes into it every year, then the irregularities will be taken care of. What else do you have? You have infrastructure or standardized training opportunities. Like I told you, only two universities, and two universities are too small to be training in a country where we have 187 million population. Only two universities. Obafemi Awolowo University has been training for the last 35 years. you know then you also have individuals lack access. The therapists themselves, they lack access to continuing education. Do we have, like those who work for University of Benin Teaching Hospital? Do you have University of Benin Hospital sending them on training? Do you have the hospitals, like Uselu? Uselu has a viable occupational therapy department. Do you have them sending the therapist out on training? Do you have communication in between therapist and management, or they just leave the therapist on their own? Then you also have the result of this is um, when you have adequate continuing education, you're going to have big knowledge. The therapist is going to have a big knowledge base of their own, which will enable them better, we become better practitioners, and the patient will benefit. But because of these irregularities, you see lack of capacity to provide high quality and consistent care. And that's what we see everywhere. And that's what we are trying to change.
All right, let's take it a little bit further now. In terms of professional ethics, what core values do you believe every OT should uphold to maintain trust with their clients?
Um, First of all, is compassion. We call it empathy, and it's required in all health professions. You must have some form of you must have some form of empathy, and empathy is the only thing that drives you from day to day. You must have compassion. Compassion helps you to build trust and relationship with the client, because if I am your client and you come to me and you say your name is Victoria, and will be your therapist for a few weeks. I'm going to work on your upper body extremities. I'm going to strengthen them. I'm going to work on your activities of daily living, which include grooming, bathing, feeding, dressing, you know. And you are a banker, and you want to be able to get well and go back to work. So if I don't build trust, if you don't see trust in my eyes or you hear trust in my voice, you will not believe that I would be able to get you to the next stage. So our core value starts with us being compassionate, being compassion, integrity. We are honest, we are transparent. Most times we are over honest. When you have a patient who has stroke, I give stroke as a classic example, and the extremity is flaccid. Flaccid means that when you pick up the hand, it goes down as soon as you pick it up, you know. And then you are walking through this hand, and the patient is complaining, you are pulling my hand, you are doing that. And within 3 months, that hand that goes up freely and down becomes spastic, you know and you know that it's going to be spastic. So your honesty is to be able, and transparent is to be able to tell the patient, listen, you better let me do range of motion in this hand. You better let me teach you how to use your strong hand to move this hand that is weak. You better so you are in constant communication with your patient. You are transparent. You say, because if I don't move this hand will not move, and nobody will be able to move it after 3 months or 6 months. This hand will become spastic. So we are transparent. We are respectful, because we know that if a patient has a stroke, you should not be the amplifying voice to go and tell everybody. When they call you, say, oh, did you meet Mr. So? You say, oh, he has a stroke, he can't do this, he can't do that. No, no, no. Core values um, has, most importantly, that we have respect for clients, and we keep their confidentiality, and we're accountable, because the goal is to build a positive therapeutic relation. And the World Federation for OT also says altruism is one of the core values of an OT, and equality, freedom, justice, and all of those things are the things that drive us. Justice, especially, because we believe that patients have a right to have a right to good healthcare, and especially rehabilitation. And we're there to help them achieve those.
All right. What training or continual education initiative uh, could help new practitioners better align with the code of conduct in the field, especially as upholding the standards of OT is concerned?
There should be provision for mentorship programs for new graduates, and even seasoned OTs should be able to have mentorship programs. And which is encouraging OTs to seek out persons, who are better knowledgeable than them to guide them through their practice. We look at a workshop on ethics. The department always does that with practitioners who are working in. You teach your practitioners a workshop on ethics because we live in a society that takes everything for granted. So ethics is must be your guiding point. Then continuing education for new practitioners, regular and refreshing courses, for for seasoned professionals in the system. I used to hear somebody who say, I've been an OT, I've been an OT for 20 years. And then you say, which continuing education class have you done in the last 1 year? Nothing. I think hospitals should require that, make it mandatory that their therapists or physiotherapists or occupational therapists should have continuing education classes at least once or twice a year. They should do that as a prerequisite for sustaining employment. And then hands-on training in clinical setting. That's what we do when we have students on internship or when they come in on NYSC. So we do that. And then professionals stay updated with best practice. You cannot go wrong with reading, reading, and reading.
You cannot go wrong with reading, reading, and reading. But before we let
Yeah.
you go, let's quickly take one or two more before we let you go. How can regulatory bodies enhance their monitoring and enforcement mechanisms to ensure compliance among occupational therapists in the country?
We have a regulatory body called the Medical Rehabilitation and Medical Rehabilitation Board, which licenses the occupational therapy and the physical therapy and the speech therapist and two other professions. What do they do? The regulatory body is supposed to enhance compliance, which makes it that there's regular evaluation of the profession, there's regular audit, there's unannounced inspection. The regulatory body um, tries to do that every year. And I think it should not be a one-time affair. I think it should be a bi-yearly inspection. And there has to be the reporting systems. I don't know whether there is reporting system in Medical Rehabilitation and Therapists Board of Nigeria where you can report a therapist for unethical concerns. The regulatory board should have reporting systems for patients to a reporting therapist and for therapists reporting therapists. If you work in a place and you find that the therapist, your senior or your co-therapist is doing something unethical. Unethical means instead of having the patient pay the facility, you are now collecting the money behind. The patient is coming and you say, oh, this patient is my friend, he's just visiting me. And then when the patient comes into the department, you use all the equipment in the department to help rehabilitate the patient. Meanwhile, you have collected money behind. So if another therapist has knows that you is aware that you are doing such practice, such sharp practice, they should be able to report to the regulatory body because a stench on one therapist is a stench on all the other therapists. So I think that's what regulatory bodies should do, and that's what we are asking that they should do more of in order to help the profession to stay in the country and be sustainable. I would like to see. I would like to see the practice in all the hospitals.
Okay, the MRTB is some of your regulatory body in Nigeria. The BOT is Bachelor in Occupational Therapy. The BMROT is Bachelor in Medical Rehabilitation, Occupational Therapy. diploma
Yes.
OT is diploma in therapy. Can you help us break all this one down so that somebody who really have interest in venturing into this occupation will really have a breakdown of all this?
Yes. Um, BOT is Bachelor's in Occupational Therapy. It's a 5-year degree program. Like I said before, only Obafemi Awolowo University had it at one time. Now, College of Medical Sciences now has it. We are looking at University of Benin. About 5 years ago, when I was still the president of the Occupational Therapy Association, um, I led an advocacy visit to the University of Benin, the then vice chancellor, and there were a lot of stumbling blocks. You know that when you're advocating for something, you must be in power, and if you are not in power, nobody respects your opinion. Everybody just tells you, "Okay, we'll look at it. We'll look at it. Don't worry, madam." I revisited it with the last VC who just left now, the female VC, and her problem was that, do we have qualified um, therapists, with a doctorate degree that would actually handle it? I say yes. We have a lot of OTs who are in training outside the country, who would be willing to come and man such this thing. So the BOT is a 5-year program. The bachelor's in medical rehabilitation is also a 5-year program. Now you see the OND that you mentioned in OT. Is it OND you called it, or what did you
Yes.
call it?
Okay. There are rumors that they are going to scrap the diploma in occupational therapy. So why
Yes.
is OTAN, the Occupational Therapy Association of Nigeria, canceling diploma as not being part of Occupational Therapists Association in Nigeria? Now, according to WFOT, the World Federation of Occupational Therapy, is diploma certificate not recognized? And if it is not recognized, why is occupational therapy diploma referred to as OT assistant? Because to be an assistant is that you don't have a formal education in the course. But why do we refer to them as assistants instead of professionals? Did you get the question?
Yes. Yes, they are assistants because they will always remain assistants. They do not have the body of knowledge of OTs. In Nigeria, when I was president of the association, I went all out for us to scrap that assistant, because that assistant was given birth to by medical doctors. Instead of coming together to get a university to actually train OTs and put them out for the service of Nigerians. Instead, because they were rushing and they were eager to get government subvention, they decided to start assistant programs. Have you ever seen anywhere where there is an assistant doctor? Please tell me. Have you
We've
seen
not
assistant doctor?
we've not seen any. So you are now saying in OT you
You
don't
you
want
so
assistant
no,
occupational
because
therapist.
Nigerian doctors and especially CMDs want to they want to make professions, all the professions, assistants, so that the doctors can be the the eagle over the assistant, over the professions. And it's not possible, because you as a medical doctor has your body of knowledge, and I as an occupational therapist, I have my body of knowledge that you have no idea of what it entails. And I spent 5 years in my bachelor's. I spent 2 years in my master's, and I spent 2 years to get my doctorate. So, will I be your assistant? I can't be your assistant. Will you be able to tell me what to do? No, I can tell you what I will do with a patient, just like you will tell me what you. So
But
we are.
Dr. Amo, please hold
Listen,
on.
listen.
You
Let me
have
let me put this.
okay,
Let me
quickly
say
land,
this.
land.
Let
Okay,
me
go
let
on.
me say this. The World Federation for OT used to have assistants in countries where they are trying to get them to have BSc programs, and they do not have BSc programs. But we have moved from assistants because this country, Nigeria, trained a lot of assistants who went further to go do bachelors in India, came back. Most of them are in Canada. They are doing their PhD. Most of them are in USA. Most of them are in Sweden. So we have left that era. We are not in an era where an assistant and OND degree holder
But
will stand
Dr.
void
Amu,
for
Dr.
an
Amu,
occupational therapist. So we
Dr.
are
Amu,
not in that era again.
Dr. Amu,
Yes.
we are running out of time, but help us. These persons have actually paid school fees to go through this training for 2 years. Scrapping it, won't it affect them? And what would be their fate? Just give us a one-off answer before we go.
Okay. There are a lot of them who have gone through this program, and we have an affiliate program in India that absorbs them. Okay. So you have a lot of them who are very lazy-minded, who think, excuse my language, please, who think that because they have OND, they can have HND and they can be ascribed bachelor's degree. It's not possible because one, you do not have the body of knowledge. Two, you do not have the adaptability to work in wide range of these the professional requirements, because OTs work in physical disability, we work in psych,
Okay.
and we work in pediatrics. So as an assistant, you don't have the knowledge base to go into those three areas. And that's why we don't need it. So listen, it's good to do assistant program. When you do assistant program, take your degree to London. London will hire you as an aide and then tell you to go back to school because
Okay.
you need to go back to school. And then, so that's the beauty of being an occupational therapist. Let's
Okay,
get away
Dr. Amu.
from assistants.
Dr. Amu,
When
we
you're an
have...
occupational therapist, you make a lot of income, and you are at the verge of being able to japa,
Okay.
So countries like US, England, and all of the host of them, developed countries, you are a hot cake. So if you see OT programs in the university, instead of running to go and do medicine, please go and do OT.
Okay,
Because the
I think
benefits are
in our next engagement, we'd like you to walk us through the aspect where we have a lot of quacks. It will be interesting to you that we have a lot of quacks
Yes.
in this field.
Yes.
Personally, I've carried
Yes.
out research on this. I have interest in this because we have so many persons parading themselves as
Especially in
therapists.
orphanage homes.
You have
Especially in
them,
orphanage
they don't even
homes
have
or
OND
schools
at
with
all. They don't have
disability.
any prerequisite
Yes.
training at all,
Thank
but they
you
are
so
parading
much,
themselves
ITV.
as
Yes.
therapists. But we'll talk about that in our next edition, Dr. Victoria Amu. Thank you very much
Thank
for
you
finding
so
time to be
much.
on the program.
Thank you so much for having me. The quacks issue, we need to talk about it, and we need to
Definitely.
sensitize the general public to be able to know the difference between a trained therapist and a quack. You
Okay.
find them in orphanage homes, you find them in special school. We need to get rid of those crop, because
All right.
those crop of therapy, those crop of persons make the work of rehabilitation challenging.
Okay, thank you very much, Dr. Victoria Amu, for finding time to be on the program.